sessions. Unfortunately, Dr. Laclette from Mexico was unable to stay, and so I will be chairing this first and the subsequent sessions. I would like to start by expressing my gratitude to the Brazilian Academy of Sciences for organizing this excellent workshop on non-communicable diseases. And I will, with your permission, I will try to summarize the CVs in order to get more time for this lively discussion at the end. And we may, I think, start with the first speaker, who is Dr. Manuel Martí from Argentina. Dr. Martí is a professor emeritus at the School of Medicine of the University of Buenos Aires and a permanent member, General Secretary elected of the National Academy of Medicine in Argentina. He was the president of the Academic Council of Medical Ethics. He is also the former president of Internal Medicine Society, History of Medicine Society, and of the Diabetes Society. So we will be listening, we will be hearing from Dr. Martí his experience in Argentina.
Portugal. In my country, this time is the siesta time. Then I hope to maintain you awake during the session. Indeed, as second vocation, I have the epidemiology, especially in risk factors and in cancer related with. You know that Argentina is a very big country, not so big as Brazil. It's a country of 3 million square kilometers with 42 million of inhabitants, more or less. In 1980, the population was 28 million, but now it's 42. The mortality rate is 7.48, and the natality rate is 18, more or less. Then the country is growing up. The ethnic groups are white, mostly Spanish and Italian. Then we have also 800,000 of British people in origin, and 800,000 of German people in origin also. 98% are white. And then the mestizo is mixed with white with American ancestry. Amerindian, another non-white group, is 3% of it. 1% are really original Amerindian. We have a gross domestic product, GDP, of $600 billion, and the health expenditure is $60 billion. It's 10% more or less of the GDP. We have the GDP per capita is 15 more or less, $15,000, and the HIV/AIDS adult prevalence is 0.5 each 1,000 people. The alphabetic rate is 97.4 in total population and 26.4 with universitary education. These do not guarantee the good administration of the country, but we are from Europe. All over, we have immigration from all over the countries of Europe. We say that the Mexican come from the Aztecas, the Peruvian from the Incas, and the Argentine from the ships. More or less is true. In non-communicable disease, we have a death rate of 56%. Cardiovascular disease is 25.6%. Cancer is 20%, and the cerebrovascular disease is 6.6%. The accidents are more or less 4%, and so the diabetes. But diabetes is very sub-registered. We can see in a survey in 4 departments around Buenos Aires that the sub-registration of diabetes is 80% from the clinical records to the death certificate. It's more important than we can see. The third cause of death is the pulmonary disease, including the infectious disease, not only the non-communicable. Can we see? I'm here as a representative of the National Academy of Medicine and the National Institute of Cancer. The National Institute of Cancer is a young institution. It's 3 years old, and the director is our vice president of the academy, Dr. Clarier. Nancy. This is the building of the National Institute of Cancer. It's downtown, very near the Mayo Square and the government house. And the aims of the institute. This is the most important project against cancer that we have in Argentina. The aims of the foundation of this institute is to diminish the incidence and cancer mortality in Argentina, as well as to improve the quality of life of the oncological patients and their families through universal and egalitarian access to health. Indeed, all the cancer patients has free chemotherapy through the Social Security, through the labor unions, social health institution, and also the paid institution. But it is guaranteed the treatment free of all the patients with cancer. The Institute intends to establish and implement health policies at the national level, as well as to coordinate integrated action to prevent and control cancer, and to involve all social and scientific entities in the fight against cancer. The goals are improve the information system, improve the quality of patient care, to strengthen the availability of diagnostic and therapeutic media to improve cancer prevention, to promote the importance of early detection, to emphasize the communication strategy, to facilitate the access to support measures, palliative care, for instance, that is a very important way of treatment also in Argentina, with a lot of institutions, good institutions, and to ensure the education and availability of specialists in the whole country. We have indeed all over the country people specialized in oncology, indeed, and to stimulate cancer research too. The size of problems in Argentina is that the cancer is the main cause between 45 and 64 years of age. More than 100,000 new cases per year, almost 60,000 deaths annually. And the poverty and the lack of education influence the mortality rate, as all over the country, all over the world. This is the incidence. This is the incidence of cancer, and it's very different from the prevalence. The prevalence is lung is 16%, Colon, the second one, 11%. Breast, the third one, 9.5%. Prostate is 6.4%. Pancreas, 6.4%. Stomach, 5%. And uterus, 4.5%. We don't know exactly why we have this incidence in the 2008. The breast is the first one. Excuse me. The breast is the first one, and the lung is the first in prevalence. Is only the fifth in incidence in this year. The prostate, the second one. The uterus, the cervix uterus is 6 or 7, and the stomach, and then the kidney and so on. But the most important as incident cancer was breast and prostate, and then colorectal and lung that are first and second in prevalence. Could be the breast because, as a hypothesis, because the hormone and ovulatory, that we don't know, or because we have a lot of treatments for infertility with big quantities of hormones too, and could be also the explanation of this great incidence, as you see.